Do you know when a stroke is going to strike? Most people think strokes happen suddenly, in public, in dramatic moments. But research has shown that a significant number of strokes and many strokes occur during or shortly after showering, because some of the earliest warning signs happen somewhere much quieter. In the shower, standing still, warm water, no witnesses, no warning alarms. And because you're alone, because the symptoms fade, and because they don't look like a stroke at all, most people miss them completely. If you're over 60 or caring for someone who is, this matters more than you think, because a mini stroke, also called a TIA, is often the body's final warning before a major stroke. Before we begin, subscribe now, so you don't miss important early warning signs that most people are never told about, signs that can prevent life-changing damage if caught early. Now, let's go through the shower-related signs most people ignore, starting with the subtle ones, and ending with the one almost everyone dismisses. Sign number 1, sudden lightheadedness when hot water hits. If you've ever turned on a shower and suddenly felt dizzy, not just relaxed, but off balance, pay attention. Warm water causes blood vessels to widen. In healthy circulation, your brain adjusts instantly. But if blood flow is already compromised, even slightly, that sudden drop in blood pressure can briefly starve the brain of oxygen. People describe it as feeling faint, a floating sensation, needing to grab the wall. It passes quickly, which is why it's ignored. But dizziness that appears only when standing under hot water is a red flag, not a coincidence. This type of brief dizziness is well documented in stroke and TIA research as a common early warning sign, especially when blood pressure changes reveal underlying circulation problems to the brain. Sign number 2, one arm or hand feels weak while washing. This one is easy to miss. You reach up to shampoo your hair, and one arm feels oddly heavy. Not painful, not numb, just less responsive. You may switch hands without thinking, assuming it arthritis, fatigue, or age. But brief one-sided weakness, even lasting seconds, is a classic mini-stroke pattern, especially when it happens during a situation that already stresses circulation, like heat and standing still. Neurology studies consistently show that short-lived, one-sided weakness is one of the most reliable early indicators of TIA, even when symptoms resolve completely. Sign number 3, sudden trouble following simple steps. This surprises people. You've showered the same way for decades, yet suddenly, you forget whether you've rinsed. You lose track of what you're doing. You feel momentarily confused or disoriented. It clears quickly. You blame distraction. But short-lived confusion, especially without obvious cause, can signal a temporary interruption in blood flow to thinking centers of the brain. Mini strokes don't always affect movement. Sometimes they affect processing. And because they pass, they're dismissed. Clinical research on TIA shows that brief confusion or difficulty with routine tasks is a recognized early sign, particularly when blood flow to cognitive regions of the brain is temporarily reduced. Sign number 4, blurred or double vision that clears after. Steam, water, soap. Easy to blame vision changes on the shower. But here's the difference. If your vision suddenly blurs in one eye, or you briefly see double, and it resolves within minutes, that's not eye strain. That's often a visual TIA, caused by reduced blood flow to the optic pathways. This is especially concerning if it's one-sided. It happens repeatedly. It's new. Vision symptoms are one of the most ignored mini-stroke warnings, and one of the most dangerous. Medical studies have repeatedly shown that sudden, temporary vision changes, especially in one eye, are strongly associated with TIAs and are considered a high-risk warning sign for future stroke. Sign number 5, sudden fatigue or I need to sit down now feeling. This is the one most people miss. You step out of the shower and suddenly feel overwhelmingly tired, not sleepy, not relaxed, but drained, weak. almost heavy. You may feel the urge to sit or lie down immediately, even if the shower was short. This isn't normal aging. It's the brain signaling that something briefly went wrong. When the brain experiences even a short interruption in blood flow, the body often responds with sudden fatigue. Because there's no pain, no paralysis, no drama, people ignore it. But this sign is extremely common in many strokes. Sign number 6, slurred or thick speech, even for seconds. Some people notice it while talking to themselves. Others notice it when they speak right after the shower. Words feel thick. Speech sounds slightly slurred. Pronunciation feels off. It clears quickly. But any sudden speech change, even brief, is a neurological warning. Speech muscles are controlled by precise brain signals. When those signals are interrupted, even temporarily, speech is often the first thing affected. Sign number 7, neck pressure or pulsing sensation. This is especially important for older adults. Some people feel a pulsing sensation on one side of the neck, pressure under the jaw, a strange awareness of their heartbeat in the neck. This can signal carotid artery narrowing, which significantly raises stroke risk. Heat can exaggerate the sensation, making the shower the first place it's noticed. So, why is the shower a common trigger? Warm showers place the body under a very specific set of physiological stresses that are well described in cardiovascular and stroke research. Heat causes blood vessels in the skin to widen, which lowers blood pressure. At the same time, standing still reduces the normal muscle activity that helps push blood back up to the heart and brain. In healthy circulation, the nervous system compensates almost instantly. But in people with narrowed arteries, stiff blood vessels, or impaired blood pressure regulation, that adjustment can be delayed or incomplete. Research in stroke medicine and autonomic blood pressure control shows that these rapid shifts can briefly reduce blood flow to vulnerable areas of the brain. When that happens, subtle neurological symptoms can appear: weakness, confusion, vision changes, and then disappear once circulation stabilizes. Because this happens quietly, without pain, and often while someone is alone, the warning signs are easily dismissed. That's why showers don't cause strokes. But they are one of the most common situations where underlying circulation problems reveal themselves for the first time. So, here is what you should do. If any of these signs have happened, even once, do not ignore them. Many strokes are warnings, not random events. They often appear days or weeks before a major stroke. If you've been trying to explain these moments away, blaming age, stress, dehydration, blood pressure, or fatigue, still tell your doctor, even if the symptom passed, even if it only lasted minutes. Do not linger on that uneasy gut feeling. That feeling exists for a reason. You don't wait for these signs to happen again. You take action the first time. Tell your doctor exactly what you noticed when it happened, how long it lasted, and what you were doing at the time. Early action can identify circulation problems before they cause permanent damage, and in many cases, prevent a life-changing stroke altogether. Most strokes don't come without warning. The problem is, the warnings are quiet. If this helped you understand something you've experienced or might experience, subscribe. This channel focuses on early signs people aren't warned about, so problems are caught before they become life-changing. Because noticing the small signs early can save everything that comes after.